This is The Hub.
I am Gladwell Modhani. I'm a youth in this youth center. I've gained so much because I didn't have a lot of information. Actually, I did not have any information regarding condom use, any contraceptives, because to me, given the fact that we have a culture, religion that preaches so much against sex and against use of contraceptives. I got pregnant immediately after high school. Then after, when I was 20 years, that was last year, when I came here. Now I got to learn more about that. And I would wish, that is why I wish that so many young people are going to be taught. And I love this place because young people are learning from it, especially young girls. Because all the ladies and all the young girls that would come here, the way they would talk, the way they would make their choices regarding sex and relationships, it got me interested. It's something different. It's not something that I was used to, because I was used to something, you hide it. Because your parents or older people are not supposed to see you in a relationship, you're not supposed to engage in a relationship. And even after getting pregnant, nobody wanted to talk to me about it. The only thing that you would be told is that you're not supposed to get pregnant.
My name is Albert Tobui. I'm the Executive Director for Center for the Study of Adolescence based in Nairobi. Young people are growing up with numerous challenges, including teenage pregnancy, which stands at about 20% for the ages of 15 to 19. Young people also continue to face reproductive health problems related to HIV infections, and they also have problems with issues around sexual violence. And these are all problems that can be addressed through structured and organized mechanisms, including education and well-structured service delivery that can improve the status of young people in the country.
I was almost sent out of our church, actually. And I was told that it is bad influence to others. So a few youths, actually, I was not supported by the elders in the church. The youths are the ones who supported me. I was supposed to be sent out. We were two of us, and we were supposed to be sent out of the church, and we were supposed to be summoned and told never to come back to the church. But the youths refused. The youths said that if a young person would get pregnant and sent out, then they would all get out. As in, there was that togetherness amongst the youth. So for me, if it wasn't for the other youths, not even the elders, the other youths, I wouldn't have stayed in the church. For the women, they condemned us. They told us we did not wait until marriage. We are sinners. We were called all sorts of names, and especially because I was in charge of a teens class, so I was almost sent out.
My name is Dr. Josephine Kibarumbaye. I'm the Director General of the National Council for Population and Development. Family planning uptick among the young people is still a big debate. Sometimes we want to bury our heads in the sand, but I think studies have shown us young people are engaging in sex, and we just have to see how to manage that situation. Of course, the first response is abstinence, because young people need also to have values about how to manage themselves. And this is something which is also now currently included in the school health policy, where we have comprehensive age-appropriate sexuality education, which of course there's still a lot of work which needs to be done so that the teachers have the competency to be able to talk to the young people about sexuality. So that's an area which still needs a lot of work, so that young people can delay sexual debut by abstinence. I mean, they are not parents, they shouldn't be planning their family. They have nothing to plan. But for those who are sexually active, the policy is very clear. The family planning policy does not stop young people from accessing family planning services.
I stayed home after delivering. I stayed home for a whole year without getting out of the house, because everybody sees you as a mother. You're scared of the image people have, they've painted, and they're seeing you as a lost sheep. They'll give you those bad names of a young person who's engaging in sex. Probably she doesn't. So they would even say, I don't even know the father of the child because I'm so young and all that. So, but when I came here, I guess it gave me the confidence when I came here, because there was so much information that I was given. And right now, I think I'm able to stand in front of people and say I have a child without being ashamed of it, without feeling a pinch, and without regretting the fact that I kept the pregnancy. I wish I had the information on sex and ways to prevent pregnancy and HIV, because at that time, of course, I was not thinking about HIV. Even when I got pregnant, that was the biggest issue. I wasn't even thinking about it. I think I thought about it when I heard that when you're pregnant, you're supposed to get tested. That's the only time I thought about it. But the only thing that scares you is the pregnancy, I guess. Most people right now are scared of the pregnancy because I'm thinking of how I'll drop out of school, how I'll not continue with my education, how will people view me, how will my parents view me, what am I going to do, I'm going to be a burden to my family. Those are all the kinds of things that you're thinking at that particular time. You're not thinking about HIV prevention or STI. So for me, yes, I got pregnant. I did not get HIV or STI, but I wish I had the information, because you never know. Somebody else out there is doing the same thing, and they don't know what they're exposing themselves to.
You are listening to The Hub.